Hello everybody, I am Dr. Vishal Chafle. I am consultant and interventional neurologist practicing in Apollo Hospitals, Navi Mumbai. Today we'll discuss about nutrition in stroke patient. When we discuss nutrition in stroke, then we should discuss in two parts. First is nutrition in a patient having recent stroke or acute stroke, and also nutrition or diet in a person to prevent risk of the stroke. In acute stroke or recent stroke, there are multiple factors which limit our food intake and ultimately which impair our recovery from the stroke. In stroke, there is a weakness of the hand or arm that makes impossible or difficult to have food adequately. Then there is often weakness of the swallowing muscle. We call it dysphagia. That is not seen. Suppose there is a weakness of the upper limb and lower limb that is visible, but suppose at the same time there can be weakness of the swallowing muscle which is not noticed. So that is called a dysphagia. So that makes difficult for stroke patient to swallow properly and that limit their food intake. Then there is a definite, most of the time there is a memory problem which make impossible for person to remember to take food. There is often reduced appetite or reduced hunger due to stroke, it may be due to illness, it is due to stroke or sometimes due to the effects of the medicine also. So all these factors reduce the intake of the adequate food and ultimately which impair the recovery from the stroke. So there are different strategies your doctor may give you to how to intake your food intake and maintain proper nutrition. Your dietitian may help in making your food adequate in calories and also nutrients, sometimes by addition of some food supplements also. So in this way, we can increase your nutrition and give proper dietary support for better recovery from the stroke. Sometimes we recommend some particular food with some certain consistencies. Like a stroke patient in acute stroke, we generally recommend semi-solid food to start with, because semi-solid food is easy to swallow. If patient is having dysphagia and we are giving lot of liquids, so there is a risk of aspiration. In such patient, we assess the swallowing function, bedside assessment is done, and if we are sure that patient is he can take orally, then we start semi-solid. Once we start taking adequate food semi-orally, then we switch over to normal food. That's how we manage nutrition and food intake in a stroke patient. Along with this thing, we should also give importance to the proper dietary constituents also. Like stroke patients should have healthy foods in their diet. Like they should have adequate fibers containing food like fruits, vegetables. They contain adequate fruits. They contain adequate fibers. So they are helpful in avoiding the constipation and also reducing the risk of cholesterol level. Then fruits are the natural source of antioxidant which help in reduction in the injury to the blood vessels. Then green leafy vegetable also contain folate which also reduce the risk of the stroke. And then whole grain cereals also the rich source of the folate and fiber which are helpful in the stroke patient. Then we can have adequate protein intake by giving dairy products. You can encourage eggs, especially egg albumin, egg white, to meet the adequate requirement of the protein in such patient. Then we should have milk products which are helpful. Milk products are also helpful in providing calcium and potassium which maintain blood pressure in stroke patient. So these are some aspects of the dietary aspects or nutritional aspect from the acute stroke patient for better recovery from the stroke. Then there are certain food habits which also are helpful in preventing or reducing the risk of the stroke patient. Which patient is having a risk of the stroke, they should have food in following these 5 food different subgroup. They should have adequate fruits, especially fresh fruits. Then they should have adequate vegetables of different colors and different category in their day-to-day diet. Then they should have whole grain cereals, especially oat, barley, rice in their food. Then you should have adequate thin poultry, fish with bone, then eggs, especially egg white is recommended. Then we should have adequate nuts, legumes, so that you get adequate protein intake. And then milk products, especially without cream, milk and milk substituents without cream, they are recommended. Simultaneously, you should maintain adequate hydration, avoid dehydration. Then we should avoid the food stuff which are unhealthy, like which are having high saturated fats. We should avoid such type of foods. Like we should avoid coconut oil, then palm oil, then fried items like potato chips, fried potatoes, then commercial pastries, pizzas, burgers, biscuits. This we should limit. Then coming to the ghee, ghee is actually contains almost 65% of saturated fat. So we should have moderate amount of ghee intake. Too high intake is also not recommended. For any healthy person, we generally recommend 5 to 10 ml of ghee 1 or 2 times in a week. That is sufficient to meet their requirement. So we generally recommend saturated, polyunsaturated and monounsaturated fats, and we avoid saturated food fat containing foods for stroke reduction, risk of the stroke reduction. Also, not only stroke but also cardiovascular risk reduction. Then we should reduce the extra salt or salt containing beverages. So we should limit the salt intake to less than 2.5 gram per day to reduce the risk factor from the cardiovascular risk factor and also risk of the stroke, especially those who are having higher blood pressure or those who are hypertensive and taking blood pressure medicine. Then too much sugar is also not good for your blood vessels, especially those having impaired sugar or those having diabetes and on diabetic medicine. So we should avoid foods and drinks which contain added sugar, like fruit juices, energy drinks, then carbonated drinks. They are strictly no. Then coming to the alcohol, ideally we should have abstinence from the alcohol for better stroke recovery and also the risk to reduce the risk of the stroke. Alcohol in moderate amount can be allowed in person, especially in female less than 9 drinks per week, and in male less than 14 drinks per week. We should reduce the alcohol intake to this level. Because too high alcohol intake is not good. It will increase your blood pressure, risk of stroke and also risk of hemorrhagic stroke. So by adopting the healthy dietary habits and nutritious food in your diet, we can reduce the risk of the stroke, and also we can achieve the better recovery from those who are already suffering from the stroke.